So in the use of anticoagulant, you have an idea what is an anticoagulant. Something that prevents clotting. Anti means against. Coagulation means clotting. So any particle or any substance that prevent clotting is known as the anticoagulant. So these are drugs that help prevent formation of blood clot, and sometimes they are known as blood thinners. That is another term for anticoagulant. They work by interrupting the clotting process. Here we have studied what is the blood clotting and what are the important steps involved in the blood clotting. Now, these anticoagulants primarily work by preventing the blood clotting. That is their act. That is how they are working. So, blood clotting involves a series of steps that culminate. Culminate means end and or the final stage in the formation of a fibrin clot. So fibrin clot formation is the main event or a final step in any blood clotting, and anticoagulant target various points in this process to prevent or slow down the clot formation. That is how this mechanism of clot formation is actually prevented by anticoagulant. Now here you can see these are the different types of anticoagulant. One is vitamin K antagonistic. That is one type of anticoagulant. Here you can see that the mechanism that will be it inhibits the enzyme vitamin K epoxide reductase. So this enzyme is very much important for the synthesis or formation of clotting factor 12, 7, 9 and 10. So that is a function of vitamin K antagonistic. An example is warfarin. An example is that. So their purpose or their use is that they will be preventing blood clots in people with atrial fibrillation. Atrial fibrillation is actually then the inadequate. I will show you what is atrial fibrillation. Here you can see that this atrial fibrillation so mainly in this atrial fibrillation, here you can see a picture. So atrial fibrillation is an irregular and very often very rapid heart rhythm that can lead to stroke, heart failure and other complications. So here you can find a picture that is showing the irregular and often irregular heart rhythm or irregular heartbeat. You can see the picture here. This is the picture of showing the atrial fibrillation. See, this is the atrial fibrillation. So it's simply irregular heartbeat. Then mechanical heart valves are placed or history of thrombosis. Thrombosis means clot formation. So this is the one type of vitamin K is one type of anticoagulant. Another type is direct thrombin inhibitors. Example is dabigatran. Dabigatran is a thrombin inhibitor that will be inhibiting thrombin factor 12, preventing the conversion of fibrinogen into fibrin. So that is the second type known as direct thrombin inhibitors, and they are used in preventing stroke and blood clots in patients with non-valvular atrial fibrillation. Atrial fibrillation earlier I told you in irregular heart rhythm, and treats DVT, deep vein thrombosis. That is the meaning of the DVT. And PE, that is PE is actually peripheral. So this is some idea regarding the different type of anticoagulant. Then third type of anticoagulant is direct factor XA inhibitors. That is a third type. Example is also shown in rivaroxaban and apisaban. Then it inhibits the factor 10A. 10A, that is a 10A is actually Stewart factor, prevent the conversion of prothrombin to thrombin, thereby reducing the fibrin formation. Now here also you can see that these direct factor XA inhibitors, they will be mainly used for treating deep vein thrombosis and PE. I forgot the full form of PE. Pulmonary embolism, that is the meaning of the PE. So pulmonary embolism mainly affecting the lungs. So direct vein thrombosis and pulmonary embolism and reduce the risk of stroke in people with atrial fibrillation. Then heparin is that heparin mainly acting by preventing the activity of antithrombin 3 inhibiting thrombin and factor A. So heparin is very common and very popularly used by hospital. So it is also used for a longer term treatment. So this is a third type. So there are different type of anticoagulant, vitamin K8, direct thrombin inhibitors, then direct factor XA inhibitors, then heparin and low molecular weight heparin. So these are some of the important molecules which are preventing the blood clotting, and they are all playing an important role in various activities, various different type of procedures involving our cardiovascular system.